the conclusions we could draw from this study, it was a surprise to us, because what we found in this study was that it was actually the number of donor derived T cells. It did not have an impact on the relapse mortality. It had or on the relapse cumulative incidence of relapse. It had an impact on the non-relapse mortality, meaning that the number of donor cells in the allograft, they prevented death from other causes than relapse. Whereas in my head as a tumor immunologist, I strongly anticipated that the fraction of, or the number of T cells in the allograft a high number would decrease the risk of a relapse, because the T cells in the allograft should act as effector cells, recognizing the tumor cells in the transplant or in the patient. So that was a really big surprise to me. But also pertaining to the immune reconstitution, we couldn't really find a clear signal. We found some signals on the chimerism, where we saw that an increased chimerism at defined time points associated to a lower risk of relapse, but we couldn't really show on the level of effector cells, the number of effector immune cells during immune reconstitution. But what I find really interesting here, what we need to do is we need to do a more detailed analysis of these patients, because a CD8 positive T cell is not only a CD8 positive T cell, it can be specific to viruses, it can also be specific to tumor antigens, or it could also be a regulatory T cell. CD8 positive regulatory T cells exist as well. So what I think we should do, which would, I suggest, have a big impact on the field, would be to perform a detailed immunomonitoring on these patients with myelofibrosis, not only phenotypically, but also do functional analyses where we stimulate these T cells with antigens, both tumor-specific but also tumor-associated antigens, and find out whether T cells, both in the allograft but also during immune constitution, whether these T cells, they recognize tumor antigens such as the CALR mutation, and if a strong response to the CALR mutation, it associates to an improved outcome after transplantation. So I think there's a lot to be done in myelofibrosis, also post-transplant myelofibrosis, also regarding the fibrosis in the bone marrow, which we know impact the T cell response to antigens.